नमस्कार, आप देख रहे हैं फैक्ट फाइंडर और मैं आपके साथ आकृति सिंह। इस समय आप हमारा विशेष कार्यक्रम देखना शुरू कर चुके हैं जो कि है स्वास्थ्य संवाद, जिसपे हम तरह तरह के बीमारियों के बारे में बात करते हैं, उसके इलाज के बारे में और क्या क्या लाभ हैं और क्या क्या उपाय हैं उन सारी चीजों का, वो सारी चीजें हम आपके समक्ष रखते हैं। तो आज के स्वास्थ्य संवाद विषय में हम बात करेंगे एक महत्वपूर्ण विषय पर जो कि है डायबिटीज। और डायबिटीज आज के समय में दिन पर दिन बढ़ती जा रही है। ये इतनी गंभीर बीमारी होती जा रही है कि कभी कभी इस समय पर इसका पता नहीं चल पाता है और कई रेगुलर चेकअप और दिनचर्या को लेकर भी कई समस्याएं आती है इस बीमारी में। तो आज इसी बीमारी को लेकर बात करेंगे कि कैसे इसे उपचार किया जाए, इससे निजात कैसे पाया जाए और क्या क्या जो सिम्टम्स हैं इस बीमारी में वो कैसे है। इन सारी समस्याओं के समाधान के लिए इस समय हमारे साथ स्टूडियो में मौजूद हैं डॉक्टर इंद्रजीत पाल, जो कि डायबिटीज के विषय विशेषज्ञ हैं। उनसे हम बातचीत करेंगे और उनके माध्यम से जानेंगे डायबिटीज के बारे में, इसके निजात के बारे में। तो आइए बात करते हैं और जानते हैं। नमस्कार सर।
नमस्कार
सर, सबसे पहले तो आपका फैक्ट फाइंडर में बहुत बहुत स्वागत है।
थैंक यू टू माय व्यूअर्स ऑल्सो।
सर, जैसा कि हम देख रहे हैं कि इस समय डायबिटीज का जो है उसका परसेंटेज डे बाय डे इंक्रीज हो रहा है, तो इसके पीछे के बेसिक रीजन क्या है?
एक्चुअली at first just we have to know what is exactly the common people know what is diabetes. Diabetes is, we always mean to say that diabetes is high blood sugar that should be in the normal body. So it is increased blood sugar in the blood which is higher than normal. So that is diabetes. So diabetes is once the patient is diagnosed as a diabetes, we have to understand that diabetes is a lifelong disease. Only thing we can keep it controlled with some measurement like lifestyle and exercise and diet and drugs. So we can keep it controlled, but we cannot cure it. So if the blood sugar remains high for a long time, it has lots of side effects in the organ of on all the organs of our body, especially in the eye. Eye may be damaged. In the liver, in the brain, there may be brain stroke. In the heart, there may be heart disease and heart attack. And in the kidney, there may be chronic kidney disease, then kidney failure. And in the peripherally, in the blood vessels, there may be some obstruction in the blood vessels. So there will be some lower limb gangrene and all these things. So in that way, diabetes is a chronic disease, and if it remains for a long time either untreated or uncontrolled, it will cause a lots of side effects and it will damage our vital organs. So that is why we should know about diabetes. We should also know how we can keep it controlled and what are our duties and what are the doctor's duties and what are the other health workers' duties. We have to follow all of them to keep our blood sugar control normal.
सर, जैसे आपने अभी बताया डायबिटीज के कई हमारी बॉडी के अंग में उसका इफेक्ट्स देखने को मिलता है।
Right.
तो उसी के साथ हम आपसे पूछना चाहेंगे कि डायबिटीज कितने टाइप के होते हैं और उनमें डिफरेंस क्या होता है?
Actually diabetes is a metabolic disorder that is inside our body. Every cell of our body needs energy to survive, and every cell needs to perform all the metabolic activity within the cells, and also we need energy by the cells, which energy is created by the cells by utilizing the glucose, then fat and some proteins to supply the energy so that our every cell can survive and also every person also can survive. That means for our survival we need energy, and energy is being produced by the cell with the help of the glucose and fat and these amino acids, that is protein. So if our body cannot utilize the sugar, fat, protein properly, then we are diabetic. And once there is diabetic, there will be another thing is that our diabetes is always controlled within our body by the insulin. The insulin is a hormone which is secreted by the pancreas within our just behind our stomach. The pancreas has a Langerhans cells, that is beta cell is there. These beta cells produce the insulin. So when the insulin cannot be produced sufficiently, or in some persons, especially the obese person or these motapa persons, there is sufficient insulin. By insulin, these insulin cannot being utilized properly due to some obstruction or some other resistance. So in that way we can broadly classify diabetes and the type 1 diabetes. Type 1 diabetes means when the insulin is not at all produced by the beta cell of our pancreas. That means when the pancreatic beta cell is completely destroyed by some autoimmune disease or some other reasons, that insulin cannot be produced by the beta cell, that is completely loss of insulin, that is diabetes, that is type 1 diabetes. Type 1 diabetes means the person has to survive throughout the life with the help of insulin. Next is type 2 diabetes. Type 2 diabetes is usually we used to have in the little bit earlier age and the teenager or this middle age or later on. The type 2 diabetes means either there is no insulin produced by this, the requirement is less. That means beta cell is number of beta cells is reduced. It cannot produce the sufficient insulin, so there will be our glucose will not be properly utilized, so there will be diabetes. Then or there is a beta cell is producing insulin, but this insulin is unable to act properly because of some insulin resistance. So then also there will be diabetes. That means there is a low insulin produced or the insulin produced which is normal but it cannot work properly. Then also the patient will have diabetes. So this is called either insulin insufficiency or insulin resistance, or both may be there. So in that case this is called type 1 diabetes. So type 1 diabetes, there is no insulin, we have to survive with the help of insulin. Type 2 diabetes means there is insulin is not sufficient, or beta cell is number of beta cell is reduced, insulin is less, or the insulin is produced by the beta cell is sufficient but that cannot be utilized by our cells due to some resistance because of many reasons. Then also there will be diabetes, or both may be together, either insulin insufficiency or insulin resistance. Then also we will have diabetes. And another is gestational diabetes, that during pregnancy, if the pregnant mother first time diagnosed as a high blood sugar, then also we call it gestational diabetes. So that is called gestational diabetes or GDM diabetes. Besides this, there are some other diabetes there. These are not much, very much known to the general people. This LADA, then this MODY, all these things. We will not go through about all these things. So, in general, diabetes we classify it as type 1 diabetes, type 2 diabetes and gestational diabetes. Another diabetes there is before we call the patient as a diabetes, there is a blood sugar it is not reached up to the level so that we call him as a diabetes, but it is not less as a normal. So in that period, that is, it is not very high, it is not very less also. In that case, there is some blood sugar level. In that case, we call it pre-diabetic. Before the properly diagnosed as a diabetic patient, we call it pre-diabetic. So diabetes is mainly type 1 diabetes, pre-diabetic, type 2 diabetes and gestational diabetes.
अभी आपने बताया टाइप 1, टाइप 2 और प्री डायबिटीज के बारे में, ऐसे 3 फेज में आपने डिवाइड करके बताया डायबिटीज का. तो आजकल जो टाइप 2 डायबिटीज होते हैं जो कि टीनेजर या फिर कम एज वाले लोगों को देखने को मिलता है, तो हमें कैसे पता चले कि मतलब स्टार्टिंग उसके सिम्टम्स क्या हैं?
एक्चुअली type 1 diabetes, usually it occurs in a very early, this young age or the children. So in that case, there may be sudden onset, sudden expression of the type 1 diabetes complication. Patient may not be very much warning at the before, but suddenly he will have some complication, that is we call it diabetes ketoacidosis. That in that case, patient will be severely dehydrated and he will blood sugar will be very high. So patient will have lots of he may be even unconscious and all these things. So in that case, he will go to the doctor, and in that case we have to give the management. We have to diagnose the patient he is a type 1 diabetes with some help, with the help of some blood test or some urine and other tests. So in that way we can diagnose the type 1 diabetes. And type 2 diabetes, we have to, when the patient, usually the type 2 diabetes patients, they may have, not all the time. The classical sign symptoms of type 2 diabetes is, number 1, patient may feel thirsty. That is, he will feel to drink water frequently. Number 1. Number 2, he will have he will feel more hungry. Hunger. He will have hunger. He will be felt more hungry. Polyphagia, we call polyphagia. Or he may have loss of weight, or he may have the very weakness, and suddenly suddenly if there is some infection, patient may come to us, and if we do the blood sugar level, we can diagnose that his blood sugar very high. So in that way, he was not knowing that he has diabetes, but because of some complication, he has come to us. We have examined the blood sugar. He is diagnosed as a diabetes. So classical criteria for the sign symptoms of the diabetes is more feeling of thirsty, then feeling of more hungry, then there is a more urination. Repeatedly he will go to the bathroom. Frequent urination and body weight loss and some complication which is not cured with the normal way or time. So in this way we can diagnose with the examination of our blood. Mainly, without doing the blood sugar properly, we cannot call that he is diabetes. We can only think that he may have diabetes.
सर, अभी आपने कुछ पॉइंट आउट बताए हमें कि ये चीजें होती हैं, जैसे थर्स्टी एंड यूरिन का हो गया, ऐसी बहुत सारी चीजें आपने सिम्टम्स हमें बताया कि इसकी वजह से शायद डायबिटीज हो सकता है. अभी हमारा डाटा, मतलब कुछ साल पहले मिनिस्ट्री ऑफ हेल्थ इंडिया गवर्नमेंट ने अभी कुछ पहले डाटा निकाला जहां पे पता चला कि जो सिम्टम्स मेंशन किए गए हैं वो सिम्टम्स पता भी नहीं रहते, फिर भी जब पेशेंट चेकअप कराने जाता है तो वो डायबिटीज निकलता है उसको. तो उसके पीछे के रीजन, कभी कभी ऐसा होता है कि हमारे पास, जैसे आपने मेंशन किया कुछ सिम्टम्स के बारे में, सिम्टम्स भी दिख नहीं रहे हैं, फिर भी हम जब चेकअप कराते हैं तो डायबिटीज होता है. सो
वेरी फ्यू पेशेंट. Actually, another thing, type 1 diabetes is very few percentage of patient, only 5 to 10%. Beyond that, near about 85 to 87%, or even 90% patients are type 2 diabetes. Gestational is only few percent, very minimum percent, 4-5%. So this why we cannot patients will not have the same symptoms for every diabetic patient. Reason behind, the patients who are obese, they are all mutapa. Patients whose weight is more than he should have, that is, his weight is much more than normal. In that case, his body is overweight, or we call obese. So in those obese patients, there is insulin resistance. Insulin resistance means his body is producing more insulin to fulfill his requirement, but it is not properly working. So insulin is coming in the beginning. So he will not have the complication, and he will not complain about the thirsty and feeling hungry, because he is forcing his beta cell to produce more insulin, because his body needs more insulin. But obese patients, there is also insulin resistance. So one side there is insulin resistance, another side body is telling the beta cell you produce more insulin, so that we can cope up the situation. In that case, gradually the beta cell going down. So ultimately his beta cell is going down. So there is insulin secretion is minimum, or less. So initially the patient may not complain of the clinical symptoms of thirsty and feeling hungry, all these things, because there is insulin resistance overcome by producing the more insulin. That is the reason.
अभी तक हमने बात किया कि जो सिम्टम्स रहते हैं उसके बारे में. कभी कभी हमारे सोसाइटी में लोगों की ऐसी मिथ है, जो हमारे सोसाइटी की, कि जो डायबिटीज होता है वो जेनेटिक होता है. तो उसके बारे में आप क्या कहना चाहते हैं?
एक्चुअली द कॉजेस ऑफ डायबिटीज, देयर आर सम रीजंस. वन इज जेनेटिक. टाइप 1 डायबिटीज इज यूजुअली ऑटो इम्यून डिजीज. दैट मीन्स our body will produce some antibody, our beta cells against our beta cell. Those beta cell, body thinks that our beta cell is his enemy. So he creates antibody against his own cell, that is own enemy, thinking his beta cell is enemy. He produces antibody. So these antibody damage our beta cell, that is enemy, thinking that our beta cell is enemy. That is called autoimmune disease. Body creates autoimmunity against our beta cell. That is autoimmune disease. That is number one cause, and another is genetic. So in the genetics, most of the type 1 is type 1 diabetes. There may be less number of this genetic, but autoimmunity is much more common. And in type 2 diabetes, definitely there is the genetic cause is there, because there is a familial history. mother father is diabetic, or and this before that also our generation there is a diabetic patient, so there is a chance of having diabetes. So genetic factor is there. So besides the genetic factor, another important cause is your obesity and lack of physical work. If we don't do the much work and if we consume much energy, where the energy will go? It will store within our body. The energy means calorie. If we consume much more calorie than we need, then it will store inside our body. It will store in the belly, or it will store in the liver. It will store in the muscles. Everywhere it will store. So these will cause your overweight, or ultimately it will destroy our many organ and blood vessels. So ultimately that also another reasons overweight and not working properly. You are consuming energy, but you are not spending the energy. So where the energy will go, it is stored within your body. The body, if the calorie or energy as a fat, it deposits in the pancreas, in other organs, it will damage the pancreas also. So ultimately beta cell also will be damaged. So these are the causes of the without money. That is, when you don't work properly, when we are not working properly, the physical work is less. In that case, we are taking much energy. Then also there will be more fat deposition in the beta cell, that will damage the beta cell. Insulin will be less. So number one is the lifestyle. There is most lifestyle disease. That means overeating, not working properly, and your fast food. If you take the fast food, that is means ready-made calorie, high calorie, energetic food, suppose which is have much more glucose, which is having these drinks and the oily, this fast food substance. That is, these are all ready-made calorie you are consuming. So you need much to digest. So you are taking calorie which are being absorbed in the body. So much glucose, it will be deposited in the body as a fat. So ultimately there will be diabetes. So diabetes means not only diabetes, in that case obesity, there will be diabetes, there will be hypertension, and there will be this automatically, then the symptoms, other symptoms in the organ will start.
अभी जैसे हम मिथ के बारे में बात कर रहे थे कि जेनेटिक जो होता है डायबिटीज, तो कितने % चांसेस है, ये जो मिथ है जिसको आपने बोला कि कहीं ना कहीं वो चीजें सही है कि जेनेटिक होता है डायबिटीज, तो कितने % चांसेस है कि अगर हमारे पेरेंट्स को डायबिटीज है तो हमारी जो न्यू जनरेशन है उसमें डायबिटीज हो सकता है?
Genetic we cannot help. Once the patients, suppose when I was born, or at the time of my womb, that is when I was my mother wombs, that is fetal life. That time only I am programmed from the genetically, my beta cells is programmed that tomorrow there is a defect gene in my beta cell. I may have, after birth, I may have, in due course of time, I may have diabetes. That is genetic. That gene is defective. Beta cell gene. That is in the pancreas beta cell. Beta cell is not this good as a normal person. So it is after birth, gene is defective. So there may be diabetes. So we cannot change it. Only thing is that we can keep it not to avoid diabetes by keeping our body weight control and keep our lifestyle is maintained properly, taking the balanced diet, not high rich calorie food. All these things if we don't take, then we can keep our diabetes not to expose at the very early. We can defer it by maintaining the very good lifestyle. We can defer it. Even we can keep ourselves control. And if we cannot maintain our lifestyle properly regarding our food and doing the good exercise and the thinking and meditation, all these things, if we cannot keep our blood sugar control, and if we cannot keep our weight control, so in that case the blood sugar will be exposed very quickly.
सर, जब हमें डायबिटीज होता है या किसी पेशेंट को डायबिटीज होता है तो क्या सबसे ज्यादा कौन से बॉडी पार्ट को प्रभावित करता है? वो किस पे ज्यादा इफेक्ट्स देखने को मिलते हैं?
क्वेश्चन
सर, मेरा क्वेश्चन है कि जब हमें डायबिटीज होता है तो सबसे ज्यादा शरीर के कौन से बॉडी पार्ट में उसके प्रभाव सबसे ज्यादा दिखते हैं, डैमेज होने के चांसेस?
एक्चुअली द बेसिक थिंग्स, डायबिटीज मीन्स देयर इज ए इंसुलिन कम और वो ठीक से काम नहीं कर सकता है. सो इंसुलिन इज ए वेरी इंपॉर्टेंट हार्मोन बिकॉज we are taking the energy in the form of either glucose, or energy also come from the fat. Energy also comes from amino acid, that is protein, fat, amino acid, protein, and carbohydrate, that is glucose. This glucose to be go inside the cell for the proper utilization and metabolism in the cell cytoplasm and in the mitochondria to produce energy. Thus, if we cannot give sufficient insulin to put the glucose inside the cell, so cell cannot produce the sufficient energy. Ultimately, cell will strike. It will damage. So these damage will start initially in the blood vessels. Blood vessels, in every organ we are having blood vessels. And at the same time, our lipid profile. Lipid means at the same time when there is insulin deficiency or insulin resistance, our lipid, that is cholesterol, triglyceride, LDL, there will be some abnormality. So these cholesterol, LDL cholesterol and triglycerides, they also, if they remain for a long time in a higher level, then also they will cause damage to the blood vessel epithelium. So in that case, our blood vessel will be damaged. So there will be atherosclerosis, there will be thrombus formation in all the organ. So ultimately, blood is the only thing where the cell, where the blood will supply the energy. Blood will supply the nutrient to the every cell. So if the blood vessel is unhealthy, so this problem will start. Like this problem gradually starts almost in the many organs. So in the eye, when there is eye, we call it retinopathy. If there is a brain, there is a stroke. In the heart, then the heart disease, that is in general we call it cardiovascular disease. In the heart and vessels, it is cardiovascular disease. Brain also there may be stroke. In the heart, there may be heart attack or coronary artery disease. In the kidney, there is a gradually there is a blood supply is reduced, then these nephrons will be damaged. So ultimately there will be chronic kidney disease, ultimately failure. So in that way, and also in the lower limb blood vessels, the blood vessels, they are also very much narrowed. So blood supply is not proper. Ultimately the blood supply is not proper. Then there will be infection or whatever it is. There will be damage to the this lower limb. So almost all organ may be damaged, but in mostly the eye and this heart and kidney develops. They will have the same symptoms little bit earlier.
सर, हमने कुछ डेटा एनालाइज किया जिससे हमें रीडिंग में पता चला कि जब डायबिटीज होता है तो आज से पहले मतलब 6-7 साल पहले या अभी तक के जितने डाटा आए हैं उसमें सबसे ज्यादा मेंशन किया गया है कि हमारे बॉडी पार्ट में हार्ट में जो होता है वो सबसे ज्यादा इफेक्ट करता है। राइट। हार्ट अटैक जिसको बोलते हैं। तो क्या मेन रीजन है कि जो पिछले 10 साल के जो हमने डाटा एनालाइज किया उसमें पता चला कि हार्ट सबसे ज्यादा इफेक्ट करता है बाकी बॉडी पार्ट से, तो उसके पीछे रीजन क्या है? रीजन
इज दैट हार्ट इज द ऑर्गन व्हिच पंप्स in every minute it pumps 60 times per minute. So when it works, heart is a pump. Pump means it needs energy. So wherefrom it will get its energy from its own coronary blood supply. Coronary artery, then through the coronary artery, blood will go to the every heart cell, every heart cardiac muscle. So individual cardiac muscle should get the sufficient oxygen supply and nutrient. So if there is atherosclerosis or if there is a thrombus formation, due to high blood sugar, due to high lipid problem, so the heart vessels will be stenosed. So due to stenosis, there will be heart block. There is a thrombus formation. So there will be coronary artery disease. If the coronary artery is the thrombus is 100%, then there will be heart attack. So that is the reason. Initially, the heart vessels, heart pumps very. Per minute it is pumping 70 to 80 minutes per minute. So it needs maximum energy and maximum nutrient. So that is why heart requires more blood, more nutrients, more oxygen. So that is why our heart will show the signs symptoms earlier. Moreover, not only that, if I have the diabetes today, I am diagnosed as a diabetes today. I am not diabetes today itself. Probably my problem started much more earlier. Probably it starts before 5, 6, 7 years before. Gradually, that is blood sugar is going up. That is called pre-diabetic. Only thing is that when the patients have some complaint or in the routine checkup, his blood sugar diagnosed that his blood sugar is too much to call the diabetic patient. So for the last 5, 6 years, he is having the blood sugar high. He is because his blood vessels are continuously damaging. So one day he diagnosed his patient of heart or brain or some kidney. So that is why, not that when the patient diagnosed, his problem will start from today. It's already he is having the problem for the long back. Probably he has diabetes for the last 5-10 years. Only thing is that he is diagnosed because his body compensate. His body compensate, he did not understand that I am having much problem. That is called compensatory stage. That is why we must have the checkup, regular checkup. Some persons are very much risk patients. Those who are fatty, whose forefathers are diabetic, brothers, sisters are diabetic, who is having higher urination or much thirsty feeling and very lethargic, and whose weight suddenly lost. Those patients, they should check their blood sugar very regularly. And regarding our mother and our this we call this pregnant mother. So they also before they become pregnant, they should have their blood sugar level, whether it is normal or not. If it is not normal, he has to take advice from the doctor, and his blood sugar should be normal. Then only he will conceive. Or if suddenly he diagnosed during pregnancy diabetes, and his blood sugar should be kept controlled only with the insulin. Usually only with the insulin, usually no other drugs.
सर, अभी आपने बोला कि हमें अपने बॉडी का रेगुलर चेकअप कराना चाहिए. तो एक इनिशियल एज होता है कि कोई इनिशियल एज है कि इस एज के बीच में ये रेगुलर चेकअप होना चाहिए, और अगर है तो वो कौन कौन से चेकअप है जो ज्यादा इफेक्ट करते हैं, ज्यादा उभर के पता चलता है कि ये डायबिटीज के रिजल्ट में ज्यादा बेहतर है?
एक्चुअली बिफोर तो देयर वाज एज, there is a limit, but nowadays even the younger people they are also having this diabetes.
So usually सर मैं आपको रोकूंगी यहाँ पे कि पिछले जब मैंने 10 साल के चीजों को देखा, एनालाइज किया, तो उसमें पता चला कि पिछले 10 साल से और अभी तक जो यंगर जनरेशन है उन पे डायबिटीज ज्यादा देखने को मिल रही है.
Exactly. So reason behind is the lifestyle. This our young generation, they are taking much more calorie than they require or than they need. So these ready-made calorie they are taking. Suppose the cold drinks, this comes some drinks, the junk foods, and these are all ready-made calories. So suddenly their blood sugar is becoming high. Number one. And number two, there are some patients who are not working. They are taking calorie, they are taking food normal. Okay. But they are not spending it, they are not working for that. They are spending their time returning. Only sitting in the table or sitting in the chair, like these official workers. They are working only by sitting in the chair. So they are spending minimum calorie. So our most important this message that you should take your food in the form of calorie. You should take only as much as you need. Don't take much calorie which is not being utilized by your body, then it will be deposited. It will cause some harm. And number one. Number two, your food should have the carbohydrate which is not refined carbohydrate. Refined means maida, then refined chawal, and those things. You should, and this glucose and these sweets and these things you should not take. You consume this complex carbohydrate. Complex carbohydrate means you can take this whole grain. Whole grain means it is not much refined. Then you should take much fruit. You should take much vegetable and fruits. So these are the complex carbohydrate you should take, so that your blood sugar should not shoot up very quickly. This is number one. Number two, you should avoid the cold drinks. They contains lots of calorie. Those calories you don't need. So you should cut your calorie intake in that way also. These are harmful. These are not at all useful. And some this burger you have told this fast food. And fast food also, they are very much oil. They are very much using the oil. Oil that is fat. That also contains very high amount of calorie. So if you take the much oil or fat, so these are you are consuming much more calorie, so that you don't need. So that in that also your body will deposit it in the different organs or in the belly or in the liver. So fatty liver will come. In the pancreas there will be some damage to the even pancreas. So in that way you should avoid all things fast food. You should avoid this fried food. You should avoid the drinks. You should avoid the chips, and because all the chips they contain lots of this salt. This salt also, that sometimes this high salt intake may be the cause of being hypertension. So to prevent the high blood sugar, you should consume your calorie as much as you require. Don't take much calorie. If you take, you spend it by your working much work and doing exercise, regular exercise you should do.
सर अभी आपने ये बताया कि हमें क्या क्या रोक करना चाहिए अपने डेली के लाइफस्टाइल में.
yes.
उसके साथ मैंने एक और क्वेश्चन ऐड किया था आपसे कि कौन कौन से टेस्ट और कौन कौन से टेस्ट जो इस समय है हमें कराने चाहिए और सबसे ज्यादा इफेक्ट कौन सा टेस्ट करता है.
एक्चुअली previous question was the answer I did not. Now to we will prefer the screen of the young generation before 24, 25 or those who are obese, mota. That means their body weight is much more than they should have. We should screen them. We should screen all the general people whose father, forefather or brothers are diabetic. We should screen our all mothers who are married and who are supposed to have their children. We must screen all of them. And during the screening, there may be some patients, we can diagnose that some patients are diabetic. Screening should be done either 30 or 25 years, even though they don't complain of being diabetic patient, but we should screen them. If normal, it's okay. If his blood sugar is normal, then we should ask him to do it for another 1 year or 6 months. We should advise them in that way. If the patient is hypertensive, then also we should advise them, you keep your blood pressure controlled. If their blood lipid, that is cholesterol and this triglyceride and low density cholesterol is high, then also we should advise them, you should keep your cholesterol controlled by you consuming minimum carbohydrate, because most of the cholesterol synthesized in the body and triglycerides also formed in the body from our carbohydrate intake. Fat also, there is some fat also we need, but carbohydrate is giving the most of all this cholesterol and all this glucose, these things. So we should consume our refined carbohydrate intake minimum, and fat also we should take minimum. And our doctoral advice which fat you should, which fat you should not, and what should be the amount of your calorie, from where you will get the calorie, how much calorie you will take. Actually, these are also we should advise to our patient. He can go to the dietitian or he can consult his physician. Our doctors are there, specialist doctors are there. They will discuss thoroughly. They will ask the question. They will try to know as much as possible how to remain in a better, how to pass the better life with diabetes or without diabetes, or if diabetes, to keep the control, to keep the diabetes control. Everything patients should be understand properly. Patient's relatives should know how much help they can give to the patient. So these are all comprehensive formula. And to know that blood sugar, this level, there is a normal blood sugar. Suppose I am taking the blood, I am telling about the type 2 diabetes. In type 2 diabetes or even diabetes, type 1 diabetes, all diabetes. Diabetes means blood sugar, normal fasting means 8 to 10 hours fasting blood sugar. Patients remain fast for the 8 to 10 hours. Then in the next morning, if I take the blood sugar, fasting blood sugar should be less than 100. If it is below 100, normal. And if then I will give him some food, for example 75 gram of glucose. Then after 2 hours I will take his blood and I will examine his blood. If it is less than 140, then it is normal. If it is above 100, above 100, but above 140, but below 200, he is pre-diabetic. And fasting blood sugar, if it is more than 100, but below 126, it is pre-diabetic. And if his HbA1c, if less than 5.7, it is normal. If his HbA1c 5.7 to 6.4, it is pre-diabetic. That is pre-diabetic we call only when his blood sugar, fasting blood sugar is more than 100 but less than 126, and postprandial blood sugar, there is after 2 hours of food, if it is more than 140 but less than 200, it is pre-diabetic. And HbA1c, if it is less than, it is more than 5.7 but less than 6.4, is pre-diabetic. So if to call a patient diabetic, normally that his fasting blood sugar should be above 126. And postprandial blood sugar, that is after 2 hours of this food, his blood sugar should be more than 200. And HbA1c should be 6.4. Then we will call him diabetic. So diabetic means normal, then pre-diabetic, then diabetic. So this is the criteria we always examine from our blood.
सर, हमने मेंशन किया अभी आपसे बात करके कि जाना सिम्टम्स के बारे में, टाइप्स के बारे में और प्रोसेस के बारे में कि कैसे बॉडी में सेल्स और डैमेज और ये सारी चीजों के बारे में आपने बताया। तो उसके साथ में आजकल का जो हमारा लाइफस्टाइल है, हम बहुत ज्यादा अपने कामों में बिजी रहते हैं और स्ट्रेस लेते हैं, तो क्या स्ट्रेस से भी डायबिटीज होने के चांसेस ज्यादा रहते हैं?
स्ट्रेस मीन्स देयर इज सम नेगेटिव हार्मोन्स व्हिच आर नॉट गुड फॉर आवर हेल्थ, सपोज एड्रेनालिन, नॉरएड्रेनालिन, कोर्टिसोल. These are all stress hormones. So they will causes sometimes they will release more glucose. They will break down the more fats. They will causes the breast constriction, and so blood sugar will be less. So they may cause damage of blood vessels. So there will be diabetes also may be one of the reasons in that case. So stress, we have to avoid the stress, and we have to avoid the stress. We should do meditation or something like that, and we should be happy. We should enjoy our life in a positive way. We should not be all the time. We should be negative. We should not think negative way much. We should think positive way to help the people and to spend the time with our friends and to help the people in a positive way. So these are the good things. We should meditate also sometimes. It is very much useful.
सर, अगर किसी को डायबिटीज हुआ है, कोई डायबिटीज का पेशेंट है, तो रेगुलर चेकअप जो होते हैं उसके साथ साथ कितने टाइम के गैप में वो चेकअप लेने चाहिए?
Actually, type 1 diabetes means insulin only. He has to take insulin. But the how much insulin he or she should take, that depends his blood sugar level. So today you are taking insulin this much. Tomorrow your blood sugar may be little bit high. In that case, you have to know how much insulin you have to increase. So that means you have to examine your blood daily. So in that case, we call it the self-monitoring blood glucose level. You have to maintain. You examine your blood. So that means you have to purchase the glucometer. You have to know how the blood sugar is measured. So in that case, you have to know to properly managing your dose, insulin dose. So every day you should maintain your blood sugar. Even not only every day, even before fasting, before morning breakfast, before lunch, before dinner, like this you have to examine your blood sugar. And for the patient type 2 diabetes, actually these are all very much sophisticated examination. If I tell every day you should take, they all patients also they will not do it. But better if there is a serious complication, some food injury or food ulcer or gangrene, all these things, and if there is some patients who waiting for operation, in that case we have to do blood sugar daily, so that his blood sugar is kept controlled. He can undergo operation. So otherwise we will advise him, you do weekly or you fortnightly examine your blood sugar. Like this we will ask the patients to, and if the mother is pregnant mother, we have to ask him to do the blood sugar frequently, so that his insulin dose is properly managed, so that his blood sugar is fasting below 92, and he is not like this other patients. The pregnant mother blood sugar she should be kept much more lower. Fasting blood sugar should be less than 92 millimeter per deciliter, and postprandial blood sugar should be less than 120. So to maintain that blood sugar and to adjust the dose, he has to check her blood sugar frequently.
सर, हमारे चैनल के माध्यम से जो इस समय डायबिटीज के पेशेंट हैं, जो डायबिटीज से जूझ रहे हैं, उनके लिए कोई विशेष संदेश आप देना चाहते हैं?
संदेश तो ये है, अगर आप डायबिटीज पेशेंट हो whether you are diabetic patients or not, if your mother is diabetic, or during pregnancy if your mother was diabetic, then in that case you should have your blood sugar level screened, properly investigated, so that to know whether you are diabetic or not. Above 30-40, you should check your blood sugar even though you are normal. And our pregnant mother, even though their first visit, their blood sugar should be maintained to know that whether their blood sugar is normal or not. Because if they are diabetic, there will be special measures should be taken for them. And another is the then diagnosis. Next is lifestyle. If you are overweight, you reduce your body weight, do the exercise, physical exercise, some resistance exercise you should do. Only by doing exercise you will lose your calorie, your weight will be reduced, you can keep your blood sugar, hypertension, lipid profile normal. And number 4, and exercise. Every day you should walk at least not less than 30 minutes. Every day 30 minutes. If not every day, then weekly 5 days. You should walk more than 30 minutes, because if you walk 30 minutes, your only stored glucose will be utilized from the liver and the muscle tissue. Muscle tissue, there is a glucose stored as a muscle glycogen. In the liver, there is a liver glycogen. In the first 30 minutes, you will use your stored glycogen. After that, if you walk, then you will lose your fat tissue, which is adipose tissue. That is your fat. So you should walk more than 30 minutes so that you can lose your body weight, you can lose your fat, you can keep your blood sugar control. When you do exercise, your blood circulation is very much proper. Every cell is getting much more this oxygen and nutrient. They are getting their nutrients properly, so they will have the proper nutrients and oxygen. So they will survive. They will do their function better. So you should walk. You should do exercise every day. And diet, I have told you should take complex carbohydrate. You should take fruit and vegetable. You should not drink the refined cold drinks, and you should avoid the fast food, junk food. And this is our message, that our students nowadays, they are taking all fast foods. Young people, they are taking fast foods only to become our future patients for diabetes or heart patients or all these patients. You see, there is lots of improvement in our technology and these health facilities, but number of patients dying from heart and kidney disease is not reduced. Then why? What is the reason? Reason is our ignorance. We are ignorant that how to keep ourselves healthy. We don't know. Even though we are told, we are not maintaining it properly. Even though I know that I am hypertensive, I am diabetic, I am not listening to doctor's advice properly, so that my blood pressure is not controlled, my blood sugar is not controlled. So that is, if you are not controlled, don't think that it is controlled. Your damage is going on inside your body. Only thing is that you don't have any warning. But still then, your damage is going on inside your body. If your blood sugar is normal, then more. If you are hypertensive, if your lipid profile is much more than normal, your damage will be there. So try to know all these parameters properly. Listen to your doctors, listen to your health advisor, listen to your all these health professionals, so that you can have a better health strategic way. We can help every patient, we can help everyone. If they come to us, we will have to help them. Our lots of hospital and these healthcare facilities there. So they should come, they should know from the dietitian also they should consult. Regarding hot food, they should take, hot food they should not take. In that way, we can minimize the patients, diabetic patients, hypertensive patients, and these obese patients, and these dyslipidemic patients, and then we can prevent the much more heart disease, kidney disease and brain stroke, all these things.
बहुत बहुत धन्यवाद सर आपका. आपने इतने अच्छी जानकारी हमें साथ साझा की और साथ ही बताया डायबिटीज को लेकर कैसे निजात पाया जा सकता है. तो अभी तक आप सुन रहे थे डॉक्टर इंद्रजीत पाल को, जो कि डायबिटीज के विषय विशेषज्ञ थे. उन्होंने बताया कि डायबिटीज के सिम्टम्स क्या हैं, टाइप्स क्या थे और क्या क्या लक्षण हो सकते हैं डायबिटीज के, किस तरीके से इसका क्योर है और कैसे चेकअप कराया जा सकता है पूरे. और सबसे ज्यादा उनके पूरे बातचीत में उन्होंने जो हमारे नई जनरेशन है उसके लिए जो एक मैसेज दिया कि चीजों को, अपने जो लाइफस्टाइल है उसको थोड़ा बैलेंस बना के चलने के लिए। तो ये सारी चीजें उन्होंने डायबिटीज से बताई रिलेटेड, और ऐसी और बहुत सारी बीमारियों के साथ हम अपने विशेष कार्यक्रम जो कि है स्वास्थ्य संवाद, उसको साथ लेके आपको जुड़ते रहेंगे। तो बाकी और चीजों के लिए देखते रहें फैक्ट फाइंडर। नमस्कार।
नमस्कार।